The obesity crisis in the United States is one of the most pressing public health challenges of our time. This epidemic has severe implications, not just for individual health, but for the overall well-being of the nation, as it contributes to rising healthcare costs and diminished quality of life. Robert F. Kennedy Jr., as the Department of Health and Human Services, has proposed a bold initiative titled Make America Healthy Again, aimed at tackling the root causes of obesity and promoting healthier lifestyles. Data based on the National Health and Nutrition Examination Survey conducted between 2021 and 2023 shows that 40% of adults in the U.S. are classified as obese. This marks a slight plateau after years of rising rates, which increased dramatically from approximately 30% in 2000 to 42% in 2020. This video outlines 20 potential strategies that could reduce obesity rates across the nation. These include promoting healthier diets, revising dietary guidelines, enhancing education on nutrition, and improving access to nutritious foods. Check out the full details by visiting the link in the description. Number 1. Promoting whole foods. Over processed foods. Encouraging a shift toward whole, unprocessed foods is a practical approach to improving public health and combating obesity. Research published in the American Journal of Clinical Nutrition links diets high in processed foods to increased obesity rates and chronic diseases. Whole foods, such as fresh fruits, vegetables, and whole grains, provide essential nutrients that support better health. Kennedy's proposal to prioritize these options through community programs and policies could help people adopt healthier eating habits. This strategy also fosters healthier communities by encouraging sustainable and nutrient-rich food choices. Number 2. Revising dietary guidelines for Americans. Updating the dietary guidelines for Americans is essential to addressing the obesity epidemic with the latest nutritional research. Current guidelines often fail to emphasize the risks associated with added sugars and unhealthy fats, which are major contributors to weight gain. According to the Centers for Disease Control and Prevention, CDC, approximately 58% of obese adults have high blood pressure, while 23% suffer from diabetes. Revising these guidelines to highlight healthier options could encourage better dietary habits across the nation. Kennedy may advocate for such changes to provide individuals and institutions with clear direction for improving nutrition. Number 3. Banning harmful additives. Reducing harmful additives in food is another step toward creating a healthier food environment. A study in the Journal of the Academy of Nutrition and Dietetics found that 60% of foods purchased in the U.S. contain additives like preservatives and sweeteners, which can negatively affect health. Kennedy's approach to removing these additives through legislation could push manufacturers to produce cleaner, safer products. This change would empower consumers to make healthier choices without worrying about hidden chemical risks. Addressing these additives aligns with broader efforts to promote better dietary practices nationwide. Number 4. Taxation on sugary and fat-laden foods. Taxing sugary drinks and high-fat foods has shown promise in reducing their consumption and promoting healthier choices. Public health studies highlight Philadelphia's success, where a tax on sugary drinks led to a 51% drop in sales within a year. Such taxes not only discourage the purchase of unhealthy items, but also generate funding for obesity prevention programs. Kennedy may support these initiatives to shift consumer behavior and encourage healthier alternatives. This strategy can be a powerful tool for reducing obesity rates and promoting long-term dietary improvements. Number 5. Enhancing school nutrition programs. Improving school nutrition is vital for shaping healthier eating habits in children. Research indicates that children who consume balanced and nutritious school meals are less likely to develop obesity. Reforming these programs to prioritize fresh, wholesome foods over processed options can instill lifelong healthy habits. Kennedy's plan to focus on such reforms ensures that children have access to meals that support their overall well-being and academic performance. Providing nutritious school meals is a crucial step toward addressing childhood obesity and its long-term consequences. Number 6. Increasing access to healthy foods. Expanding access to affordable, nutritious food is critical for addressing the high prevalence of obesity in underserved communities. Studies show that food deserts, areas with limited availability of fresh, healthy options, contribute significantly to poor dietary choices. Through initiatives like subsidizing farmers markets and supporting community gardens, Kennedy can enhance food accessibility and promote healthier eating in low-income areas. The CDC reports that at least 20% of adults in every U.S. state live with obesity, emphasizing the importance of equitable food access. These efforts can reduce disparities in health and foster healthier communities nationwide. Number 7. Education campaigns on nutrition. Nationwide campaigns focused on nutrition education could play a significant role in addressing obesity by increasing public awareness about healthier dietary habits. These initiatives may aim to provide clear and accessible information about the benefits of balanced diets and the risks associated with unhealthy food choices. Kennedy could advocate for programs tailored to diverse communities, ensuring everyone has the tools to make informed dietary decisions. Such campaigns might also include efforts to dispel myths about food and nutrition, encouraging better understanding and more thoughtful choices. Through widespread education efforts, adopting healthier lifestyles could become more achievable across all demographics. Number 8. Regulating food marketing targeted at children. Restricting food advertising aimed at children is a crucial step in combating childhood obesity. According to the American Psychological Association, children exposed to junk food ads consume significantly more calories than their peers who see fewer ads. Stricter regulations on these marketing practices could reduce children's exposure to unhealthy options and encourage better eating habits. Kennedy could champion policies that limit such advertising, shifting the focus toward promoting healthier food choices for young audiences. This approach supports the development of healthier habits during critical stages of growth. Number 9. Supporting local agriculture. Strengthening local agriculture connects communities to fresh, healthy food, while supporting sustainable farming practices. Programs that link local farmers to schools and community initiatives can improve access to nutritious options while reducing dependence on processed foods. Kennedy may support these farm-to-table efforts to boost local economies and foster healthier eating habits. Encouraging sustainable practices benefits both individual health and environmental stewardship. These initiatives create stronger ties between communities and the food they consume, promoting long-term well-being. Number 10. Incentivizing healthy eating through SNAP. Reforming the Supplemental Nutrition Assistance Program, SNAP, to encourage healthier purchases could make a significant impact on dietary habits. Currently, SNAP allows for the purchase of unhealthy foods, contributing to poor nutrition among low-income families. Offering incentives for buying fruits, vegetables, and whole grains would promote healthier food choices. Studies suggest that financial incentives are effective in driving positive changes in behavior. Kennedy may advocate for these reforms to align SNAP benefits with the goal of reducing obesity and its related health risks. Before we continue with the video, take a quick moment to hit that like button and subscribe if you haven't yet. And don't forget to ring the bell for notifications so you never miss out on our latest updates. Plus, we've got some helpful resources in the description. Check them out and share your comments after you're done watching. Number 11. Addressing environmental factors contributing to obesity. Environmental toxins linked to obesity, such as chemicals in food packaging and agricultural practices, present an often overlooked challenge. Evidence suggests that exposure to certain chemicals can disrupt metabolism and contribute to weight gain. Kennedy could advocate for policies promoting safer agricultural methods and stricter regulations on food packaging to reduce these harmful exposures. By addressing these environmental contributors, the initiative may tackle one of the root causes of obesity. This approach reflects a broader understanding of the factors influencing public health. Number 12. Improving food labeling standards. Clear and consistent food labeling is essential for helping consumers make informed dietary decisions. Current practices often create confusion about nutritional content and portion sizes. A meta-analysis revealed that food labeling can reduce energy intake by 7%, total fat by 11%, and other unhealthy dietary options by 13%. The same study also found that clearer labeling encourages manufacturers to reformulate products, leading to reductions in sodium and trans fat content. Kennedy could advocate for enhanced labeling regulations, ensuring that consumers have accurate and accessible information to guide their choices. This approach may empower individuals to adopt healthier diets while driving positive changes in the food industry. Number 13. Encouraging physical activity initiatives. Community-based programs promoting physical activity could significantly contribute to reducing obesity rates. Recent data highlights that nearly 23% of American adults report minimal physical activity beyond their regular jobs, underscoring the need for accessible exercise opportunities. Kennedy may advocate for initiatives that create safe spaces, such as parks, recreational facilities, and walking trails to encourage active lifestyles. These efforts could address sedentary behaviors, improving overall health outcomes. Increased physical activity not only supports weight management, but also enhances mental well-being and cardiovascular health. Number 14. Research funding for obesity solutions. Investing in efforts to prevent and treat obesity could lead to innovative strategies that address this pressing issue. Kennedy could support increased funding for programs focused on understanding the underlying causes of obesity and developing targeted interventions. These efforts may help policymakers implement more effective solutions tailored to diverse populations. By prioritizing funding for innovative approaches, the initiative could create a strong foundation for long-term progress in reducing obesity. Such support reflects a commitment to advancing public health solutions. Number 15. Collaboration with health professionals. Building strong partnerships with healthcare providers is crucial for implementing effective obesity interventions. Doctors, nutritionists, and public health officials play key roles in educating patients about healthy lifestyles and managing weight-related conditions. Kennedy could encourage collaboration across these sectors to create comprehensive plans addressing prevention, education, and treatment. Unified efforts among health professionals may ensure consistent messaging and greater outreach to communities. This approach could strengthen the overall impact of initiatives aimed at reducing obesity. Number 16. Utilizing technology for health monitoring. The use of technology to track health and fitness data could support individuals in adopting healthier habits. Mobile apps and wearable devices that monitor physical activity, diet, and other health metrics have proven effective in motivating users. Kennedy may support initiatives encouraging the integration of these tools into public health campaigns. Personalized feedback provided through technology can help individuals maintain healthier lifestyles and achieve weight management goals. This strategy leverages innovation to promote sustained behavioral changes that combat obesity. Number 17. Fostering community support systems. Creating community support systems could provide individuals with the resources and encouragement needed to adopt healthier lifestyles. Support groups focused on nutrition education or exercise programs offer platforms for sharing experiences and building motivation. Kennedy could advocate for the establishment of such networks to enhance public health efforts. These systems may address both the physical and emotional challenges associated with weight management. Strong community connections often lead to higher success rates in achieving long-term health goals. Number 18. Legislation against food industry lobbying. Reducing the influence of food industry lobbying on public health policy could help prioritize consumer well-being. Lobbying efforts often promote products and practices that conflict with obesity reduction goals. Kennedy may push for increased transparency in lobbying activities and advocate for policies that prioritize public health over corporate interests. Such measures could ensure that regulations align with efforts to reduce obesity and improve nutrition standards. Addressing this issue is essential for creating an environment where health-focused policies can thrive. Number 19. Encouraging workplace wellness programs. Workplace wellness programs could provide valuable resources to help employees adopt healthier lifestyles. These programs may include access to fitness facilities, nutrition counseling, or wellness incentives as part of employee benefits. Kennedy could advocate for policies encouraging employers to implement initiatives that promote health within the workplace. Supporting such efforts may improve employee well-being, reduce healthcare costs, and increase productivity. By fostering healthier work environments, this strategy aligns with broader goals to combat obesity and enhance quality of life. Number 20. monitoring progress through data collection. Establishing robust systems for tracking obesity trends is essential for evaluating the effectiveness of public health initiatives. Comprehensive data collection allows policymakers to identify successful strategies and make necessary adjustments to interventions. Kennedy could support the development of frameworks that monitor progress toward obesity reduction goals. These systems may provide valuable insights into community-specific challenges, ensuring that programs are tailored for maximum impact. Continuous evaluation and accountability are key to achieving long-term improvements in public health. Path to a healthier future. Addressing the obesity crisis requires comprehensive strategies grounded in evidence and collaboration. The proposed measures focus on improving nutrition, enhancing accessibility, and empowering communities to adopt healthier lifestyles. Through targeted policies, educational efforts, and innovative solutions, significant progress can be made in reducing obesity rates. These actions may not only improve public health, but also alleviate the economic burden linked to obesity-related conditions. With sustained commitment, a healthier and more resilient population is within reach. Thanks for watching, and if you found this video helpful, don't forget to like, subscribe, and share it with your friends. Also, don't forget the link in the description